It does state we're live.
We are live, and I want to welcome everybody here on the Thrive community, and want to welcome our group from the Thrive community. Quest Healthcare presents in our Bowel Care Series, Understanding Constipation and Fecal Incontinence. We are live, and I want to welcome everybody here on the Thrive community. It's happening again, and want to welcome our group from the Thrive community. Quest Healthcare presents in our Bowel Care Series, Understand. So let's see if we're still live. Hold on one second.
It says we're live. I'm seeing you're sharing your screen live.
Yeah, we're still live. So you know what? We're going to just start from scratch again. We're recording and everything. Hey, welcome everybody in the Thrive community. I want to welcome you all to our presentation tonight. Quest Healthcare presents Understanding Constipation and Fecal Incontinence in Spinal Cord Injury. We've had a lot of great programs here on the Thrive community, and it's to inform you, to help you out with what's going on in your life, to help you out with your bowel care, to help you out with your skin care, all the things that matter, a lot of the hidden parts of the disability. And I'm joined once again, and such a patient individual, especially with our virtual world these days, is the ever-talented Beth Householder. How are you, Beth?
Great, Scott. You're so sweet. Thank you very much for having us and letting us be a part of your Thrive community. We're very proud to be a sponsor of your group.
Thank you so much. And we love it. And Beth is with Quest Healthcare. And tonight, just to give you an overview, we're going to be understanding the difference between reflex and flaccid bowels, risk factors of constipation, risk factors of fecal incontinence, and also how a bowel program can help these programs. So Beth, take us away through this, because these are very important issues that affect a large majority of our Thrive community.
Yes, I just thought we'd start with a quote. Freedom of the bowels is the most precious, perhaps even the most essential of all freedoms, one without which little can be accomplished. And that's true for everybody on this planet. You need to be able to handle your bowels, move your bowels efficiently in a time-efficient manner. And that's something that hopefully we can help you achieve.
Beth, you know what's interesting though is that when we don't, and I think we all can relate to this, whether we have a disability or not, is that when we're not having good bowel movements, it seems like whether it be we're in pain, we're in discomfort, we're fatigued. And the best way I think about it, it's almost like a vehicle in which, like, if you don't run the car too often and get the exhaust and everything out, the car doesn't run efficiently. It's when you're constantly run it, not just on those short trips back and forth to the market, but when you get it on the highway and you're able to clear things out. And I think that's just like us as a human being, and why our bowel care is so important.
So true. So true. I mean, I know people with irritable bowel syndrome, and it's very disheartening for them because they spend so much time running to the bathroom. So it's with all individuals. And so if you really get a good routine going where you really empty your bowels each morning or every other morning or same time in the evening, if you prefer, it really does help you feel better and function better, and lets you get back to the things you want to do, which is be with family, friends, be productive, work, etc.
So Beth, you mentioned either going every day or every other day. Let's just say you got really, really busy and you're someone who goes either every day or every other day, but neither of those worked, and it was a third day that you put this off. What could you be looking at as a possible challenge?
Well, so the longer the stool sits in your rectum, the harder it becomes. And then there's going to still be matter that wants to move its way through, because we all have 1 to 3 mass peristaltic movements a day. So you're going to find that drippage, that leakage starting to work its way around hard stools. So it really is essential to move your bowels, for all of us, once again, to move our bowels routinely and try to stay on a schedule. I know it's difficult. It doesn't always work, but the more you can be on a regular schedule and also get a regular diet and fluid intake, that helps as well, Scott.
Okay, so take us through the differences between a reflex and a flaccid bowel, please.
Sure. So if in a patient with a spinal cord injury of a T12 or above, the sensation of full bowel may no longer be detectable by the injured person. In such cases, the anal sphincter will remain closed. However, it opens on a reflex basis when it becomes full. This type of bowel is sometimes called as upper motor neuron bowel reflex. And as the person will not be able to sense when the rectum is full, the reflex of empty can happen at any time. So that can be highly embarrassing, Scott, for patients, unless it's managed well. And that's really when we want to have a dedicated bowel time to evacuate as much as possible and as completely as possible, within a short period of time. So let's compare that with the flaccid bowel. If the spinal cord injury is below T12, there could be damage to the defecation reflex, or the anal sphincter may be relaxed or stay open. Very common with spina bifida patients. And this type of bowel is referred to as lower motor neuron or flaccid bowel. And again, it can be helped to be managed to prevent these accidental defecations by emptying the bowel more frequently at a socially appropriate time, or by bearing down or manual removal of the stool, or with a product like Enemeez that we'll touch on at the end of the presentation. So moving on. So just a quick definition of constipation for those people out there in case you don't know. But it's a condition in which a person may have one or two or all of these symptoms, but they may have difficulty in comfortably passing a significant amount of stool. Some patients complain of just partial defecation and they don't get enough out. It also could be passing less than 3 bowel movements a week. That's a classic definition of constipation. And then straining would be another example of constipation.
Beth, let me real quick with regards to straining. So I'm T7, T8, so I have my upper abdominals. And if I'm there, and remember when I was able-bodied too, is just almost like tightening that area and trying to push with that area. Is that considered straining?
Yes, yes. And the more we strain, Scott, actually, the more we exacerbate constipation. So you don't want to have to strain. So again, high fiber, high water content diets really help move your bowels, and exercise if possible. You don't
want to try to push. If you have any of your abdominals, you don't want to try to push, because that's in the category of straining, you're saying.
Well, straight is it's the pushing from the lower the rectum area. When you feel like you can bear down and push, and women actually are very good at this, Scott, because of having had given birth. If they have given birth, they tend to be very good at trying to push and move their bowels.
But Beth, I'm not even going to comment on that. I'm going to take your word for it.
So, all right, so let's move on. And just so you know, chronic constipation is when, of course, this is a routine effect for patients, that they routinely have these symptoms. So moving on. So this is a very interesting chart. This is the Bristol stool chart. It was designed in the 1990s in the University of Bristol in England. At Bristol University in England, and it talks about the transit time of the fecal matter in the colon. So if your stools look like type 1, they've been in your colon about 100 hours in transit time. Type 7, only 10 hours. You're looking for that stool between type 3 and 4, which would be 30 to 40 hours in transit time, which would look like, and this is funny that the nurse practitioner who designed this put it on here, but it would look like a Milky Way bar or so. She wants to give a visual comparison, but that's really kind of what you're looking for, like a softly formed stool. And
Beth, we have to disclose this program is not sponsored by Milky Way. So I don't want anyone thinking that's sponsored by Milky Way or Almond Joy or any of those categories right there. Okay. Just wanted to disclose that.
That's right. That's a good point. Thank you. So let's talk about risk factors for constipation. We mentioned the female. The female has a slightly slower transit time in the colon than males. And as well, hormones like progesterone for women impact the transit time for women as well and lead to slightly higher rates of constipation. But also I mentioned dehydration, low fiber intake, even low caloric intake. You want to keep eating, if possible, those healthy natural foods. And polypharmacy, Scott, if patients take 5 or more medications at a time, there's so many medications that cause constipation, and we're going to touch on a few of those on the next slide. But it really can slow your movements down. If you're immobile, whether you're elderly or SCI or whatever, that does impair mobility for your digestive tract. If you're depressed, or the drugs that treat depression, go ahead.
No, real quick. I just wanted to know, would it be wise for anyone who's listening to this, because I even remember being in the hospital and having all these little cups of meds, and you would take them pretty much at the same time. Some of you would take sporadically throughout the course of the day. If you're taking 5 meds or more now, though, do you think it's a good conversation to have with your doctor to see if there's any way of spreading it out, knowing what you know about constipation now?
I can't comment on that. I'm not a nurse myself, but that is an interesting thought process. And I think a conversation is always warranted with the doctor to understand which drugs are causing constipation and if you can take them at a certain time of day. That's a great suggestion, Scott. Maybe that would help. And then the depression itself and dementia, and then the drugs that treat these 2 classes can lead to constipation, as well as patients with renal failure or chronic renal disease, and then lack of privacy or poor toilet access. That even happens to children who, they're not in a good place, so they hold their bowel movement. And the more we do this, the more you condition your body to have a lifelong problem with constipation. So we want to really, when we have the urge to go, hopefully be close to the toilet. But ideally, Scott, if we can do this in the morning, be done with it for the rest of the day, then patients can be off enjoying their life and not worrying about this when am I going to have to find a toilet, or when am I going to have to go?
Good point. Good point.
So I just mentioned the medications, and I won't hang on this slide too long, but there are many, many medications that lead to constipation. I just point out NSAIDs and antacids, drugs people wouldn't even imagine can cause constipation. Blood pressure medications, which we need to have, of course. A lot of these are need to have medications you really can't do without, but we have to deal with the consequences sometimes of the side effects.
So I'm gonna make a recommendation. Again, Beth and I both aren't, but I'm a person with a disability, and I'm having conversations with my doctors all the time, is that I'm going to recommend that, hey, when you take your medications, is there something that I know some of them you need to take with food, but is it better to take with salads or fruits, so that you're doing things, or to take with a lot of water? So you're helping your bowels move this medication through you rather than contributing to constipation.
Yeah, agreed. And then just looking at some potential complications. Some people think, oh, constipation, no big deal. It actually is quite a big deal, and it's quite serious and can be dangerous at times. But just note that constipation is much more common as we age. Over the age of 65, the incidence goes way up. Regular use of laxatives is not your friend. Laxatives over time can damage the nerves of the colon. I've talked to many nursing home providers as well as patients, Scott, and they say that, oh, those drugs used to be working well, and now this person is 85 or I'm 85 and they're not working very well anymore. Well, they actually do negatively affect the nerves of the colon. So we want to avoid excess use of laxatives if possible. And then if you're constipated, it does drive up anxiety, depression, a perception of poor health. So again, this is for everyone. We need to move our bowels. It's a very important part of life. And then complications. We talked about that stool staying in your system, the longer it stays there, the harder it becomes. That's called fecal impaction. And eventually it becomes so hard, you may need a larger volume enema, which, for spinal cord injured patients is more dangerous. And that's why our mini-enema, Enemeez, is used so widely in the spinal cord injured community because it's safe. And then fecal incontinence, we talked about the drippage around hard stools that can occur, and it affects your bowels. I mean, it affects your bladder. If you have a lot of fecal matter in your colon and you're not moving your bowels, it leads to bladder issues like UTIs and things like that. So again, this is all connected. And then sigmoid volvulus is when the wall of the intestine kind of self wraps around the colon. And of course, that's a dangerous side effect, and you may need surgical intervention should you have that. And then ultimately, this intestinal obstruction increases morbidity. So again, just a regular bowel program, Scott, and people will be much better off.
Beth, I've seen this too work, and you talk about everything being connected. I know that there's been times where, you know what, I really need to have a bowel movement, and it's affected my bladder, whether it's forced me to leak or it's made my bladder fill up. And then vice versa, is that when my bladder has become too distended, is that I realize that sometimes that will force me to have a bowel movement. So it's interesting how the two work together. And so doing whatever you can and creating, I think that's the biggest time too, is that we want to rush things. We want to get back to our agendas rather than taking the necessary time for both our bladder and bowels to empty them.
Well said. So just so the lay person yourselves are aware of fecal incontinence, we talked about that drippage. This defines it a little more clearly for you. It's defined as the unintentional loss of liquid or form stool and or gas. Some people don't realize that if they're passing gas a lot, it's a sign you're not moving your bowels well. So again, a routine program that helps you really do a good complete evacuation is the best solution. And what are some risk factors for fecal incontinence? If you have frequent diarrhea or constipation, that becomes a risk factor. If there's muscle damage within spinal cord injury patients, there is nerve damage. Some patients that have had surgeries, like a difficult vaginal birth using forceps, these can damage the muscle. It could be a result of rectal surgery, could cause muscle damage. In older age, our muscles don't work as well, and we have muscles that become too stiff with age. And then when large amount of stool rapidly arrives, sometimes there's not enough time to reach the bathroom. And then damage to the nerves. The nerves control the muscles to the anus, and that the contractions are damaged and incontinence can result. And nerve damage can be in patients, Scott, with stroke or all kinds of reasons can cause. Even longstanding diabetics could be at risk of some nerve damage that it not only affects their intestine, but also their rectum. And then also the ability to stretch the rectum. If the muscles of the rectum are not as elastic as they should be, excess stool can build up and leak out. And inflammatory bowel diseases like Crohn's does affect the rectum's ability to stretch. And even surgery, as I mentioned before, can cause the muscles to stiffen in the rectum, especially if there's been radiation due to cancer treatment of the rectal area. But there's other causes like laxative abuse, certain nervous system and congenital or birth defects, inherited birth defects can cause problems with incontinence and inflammation to that area.
I think it's very important for us to keep in touch, to talk with that, whether it be our spinal cord injury doctor or our regular doctor in general, or a gastrointestinal specialist, just to stay on top of this. And I know in future series, we're going to talk about having a colonoscopy and doing other procedures as well as we age with our disabilities and hopefully age gracefully. But it's just something, and again, I come back to the car reference. It's something that I know a lot of people will say, hey, if it's not broke, don't fix it. But I think maintenance is very important in making sure that we're putting as much good gas. And I know we like to release gas too, but in terms of putting good gas into us, meaning good foods and good liquids, and making sure we're giving our bowels a fighting chance to flow almost effortlessly with Enemeez, of course.
Yeah, that is the truth. So just one last slide here that is valuable. They set new Paralyzed Veterans of America set new guidelines, and it really does highlight, this is just one small part of a long set of guidelines, but the importance of a bowel program in your treatment plan that designed to minimize or eliminate the occurrence of unplanned or difficult, that straining effect, evacuations, and to evacuate the stool at a regular, predictable time within 60 minutes. So it shouldn't take longer than 60 minutes. Hopefully with a product like Enemeez, it'll take a heck of a lot less. But really the goal is to minimize GI complications. And this is our last slide. I just wanted to show you, if you probably know this already, but Enemeez is a mini enema, and I'll hold it up so you can see the size. It's only 5 ml of docusate sodium, and it works very fast in 2 to 15 minutes. Sometimes I've heard 20 with spinal cord injured patients, but it works very quickly. And it simply works by transferring water into the stool. It's softening the stool, but also increasing the mass. So it creates natural peristalsis so that the body can eliminate the stool in a fast, efficient, safe manner. It's safe to use every day. And I think, Scott, you can testify to using Enemeez, and then Enemeez Plus has the advantage of benzocaine, which is wonderful for patients with a T6 injury or above, because it minimizes the risk of AD. And that's very important for patients. So that's it, Scott. I'm going to stop sharing. Did you have any questions or thoughts?
Well, I just want to say again, I know Enemeez sponsors this program, but I absolutely would not be hosting this if I wasn't a user of Enemeez as well for a number of years now. And it's just, again, you talk about the word being effortless, is that it's such an easy process. And whether you're a paraplegic or a quadriplegic, to be able to get into a routine. So whether you go daily or you go every other day, I go every other day. But there are times, knowing full well what I've eaten and everything, I might, and if I have the time, do a bowel movement every day. So it's kind of getting to know your system. But I love what Beth was talking about, and what the guidelines from the PVA determine now is that within like 60 minutes is that you want to do this. And you want to do this also around the same time each and every day or every other day, just to get your body into a system and get it synced up. And knowing full well, again, I want to emphasize this, is that the importance, we talked over a lot of complications that can occur if we do not take the time, if we do not care, if we rush things. So we want to create the necessary time for our bowel care, for our bladder care. All the things that I know are those hidden parts of the disability that annoy us are timing. But if you don't take care of these, you may be looking at a hospital stay. You may be looking at all these other things that you love to do as part of your quality of life being affected. So might as well take good care of it and get it over with, get it done. Don't rush it, because you will have an accident. I know plenty of people who rush their bowel movements. I mean, you can have an accident anytime with regards to a bowel movement, but you increase your chances as if you're rushing something and you're not fully empty. So you get to know your body. I know those who are newly injured may be in a place of struggling and not knowing and having accidents here or there. Your body's still trying to make sense of paralysis or whatever your disability may be. Those who have been paralyzed much longer kind of have a sense of what works. You know when you put certain foods into your body, you know, I'm going to have a great bowel movement. You know when you don't put, and you eat a lot of processed foods and maybe a lot of meats and so forth, and not enough salads and vegetables, you know that's going to affect you. And I think the one common denominator too, Beth, is that those people who know when they're drinking plenty of water are having good bowel movements. It's, again, when we're not taking the time to take in the necessary liquids we do. And if it's during the summer and the temperatures have increased even more so, we need to increase our intake. But again, we get busy, we get caught up in things, and we don't. and we will suffer because of it. So we got to be vigilant in our care. And we were given so many reasons why tonight by Beth, why it's so important to be vigilant. So Beth, I want to thank you as always for joining us here in the Bowel Care Series. Thank you for your knowledge, your expertise, your patience with technology and me over here. I still don't know what happened this morning, but anyway, you can't get too frustrated. Again, I'm bringing our virtual world with a bowel movement. You get frustrated, you get all disgruntled. Is that, you know what, you're going to have an awkward time if you kind of just take a deep breath and be patient. Eventually it will work. See, Beth, we can draw comparisons to everything too.
Exactly. Well said, Scott. Well said. Thank you. Thank you for having me.
We look forward to having you again soon. And I want to thank everybody from the Thrive community. And again, if you have any questions whatsoever, you can always post them in the comments here and let us know what you're thinking. And we'll absolutely address your questions. So once again, Beth Householder from Quest Healthcare, I want to thank you. I want to thank Enemeez for sponsoring the program. We'll be back. The Bowel series continues, and we'll see you next month with another installment. So thank you so much for joining us, and we'll talk to you real soon.
See you soon. Thank you. Bye.